Hi guys, welcome back to my channel. In this video I'm going to discuss about hepatic jaundice, or what is referred to as hepatocellular jaundice, its causes and the lab diagnosis. Please watch and subscribe. Hepatic jaundice is as a result of a diseased liver, a damaged liver, or a scarred liver. A scarred liver is the one that has been hardened in case of alcoholism. We can also have another cause, that is obstruction of the internal ducts of the liver, which pass out the liver products such as direct bilirubin and bulges into the gallbladder via the bile ducts. These two products builds up in the liver and leaks into the blood plasma. And since bilirubin is yellowish in color, it results into the yellowishness in the white part of the eye or onto the skin. The two signs we talked about, which are first observed in a hepatic jaundice or any other type of jaundice. There are so many causes of hepatic jaundice, such as liver cancer. Another cause is bacterial infection. Example is leptospirosis. You also have biliary obstruction, referred to as intrahepatic obstruction. Another cause is liver cirrhosis due to excess alcohol intake or toxicity in the liver. In this case, the liver becomes hardened or scarred. Another cause is viral infection. An example of a common disease we know is hepatitis. It's a viral infection that affects the liver. We do have another condition referred to as Gilbert's syndrome, where the liver is unable to process or conjugate indirect bilirubin. We do have Ziegler-Naegeli syndrome, that is similar to Gilbert's syndrome. We also have another condition referred to as Rotor syndrome, where we have impaired hepatocellular storage of conjugated bilirubin. We do have Dubin-Johnson syndrome, where we have defective hepatocellular secretion of conjugated bilirubin into the bile or into the gallbladder. When it comes to lab diagnosis, we collect 3 samples: the blood, urine, and the stool. In the blood sample, we conduct liver function tests, where we test for the total bilirubin, direct bilirubin, and indirect bilirubin. All these 3 parameters are found to be elevated in their levels in blood plasma. We do test for the liver enzyme, that is alanine transaminase, which is elevated in case of liver damage; aspartate transaminase, which is elevated also in case of liver damage or a diseased liver. Alkaline phosphatase is found to be within the normal range or slightly elevated, that is. Gamma glutamyl transferase is elevated. This is due to alcoholism. In case of excess alcohol intake, this is the marker enzyme, which we can use to determine the level of alcoholism. We also test for the liver proteins. They are also produced in the liver. So in case of a damaged liver or a diseased liver, we expect to find total protein in low levels, albumin also in low levels, and globulin in low levels. Prothrombin, I told you last time, in case of prothrombin, we do conduct prothrombin time. That's a special test for prothrombin, where in this case of hepatic jaundice, it is increased. So the other type of test in the blood sample is the hemoglobin level, where in the case of hepatic jaundice is within the normal range. We also conduct a red blood cell count. In case of hepatic jaundice, it's within the normal range. We can also conduct peripheral blood staining, which is not necessary in this case of hepatic jaundice, so we don't expect to find any abnormal shape of red blood cell. In the urine sample, we conduct a test for 3 parameters, that is bilirubin, urobilinogen, and the color of urine. Bilirubin is usually present in urine in case of hepatic jaundice, and the type of bilirubin present is direct bilirubin. Remember, direct bilirubin is soluble, so that's why we expect to find it in urine. Urobilinogen is increased in levels. The color of urine in this case of hepatic jaundice is yellowish. This is due to presence of bilirubin in urine. In stool sample, we observe the color. In this case of hepatic jaundice, the color is slightly pale. This is due to minimal amount of bilirubin being released into the gastrointestinal tract. When bilirubin is released into the gastrointestinal tract, we expect to find it in stool. So when it is released in minimal amount, the stool is usually pale in color. So other non-lab tests are MRI or ultrasound. This is all about imaging. We do have endoscopy. This marks the end of our video. Please watch and subscribe.